I was going to ask about the PTSD because you talk about that. You're passionate about the PTSD. So we're talking about post-traumatic stress disorder. In my mind, it was always something associated with war because
Right.
obviously, retired army veterans tend to suffer from PTSD. And in fact, I've known personally a few people who suffer PTSD. What is PTSD and how does it trigger food addiction specifically?
I think we use the term PTSD a lot because it's the term that's in the DSM-5. It's the clinically recognized term, but there are a much wider range of potential trauma that can exist for someone. So we use the term trauma, which doesn't have an actual clinical definition, and that can include other forms of trauma like complex trauma, which isn't associated with a single event. Generally, PTSD is linked to an event like going to war, getting in a bad car accident, abuse, etc. Whereas there are other forms of trauma that aren't just linked to a single event, but the way that people experience life, perhaps in relational health. Maybe they had a very dysfunctional relationship with someone, and it wasn't one thing that was traumatizing, but the legacy of multiple exposures. Sometimes I use the term micro traumas that can really have an impact. But, because PTSD is the clinically recognized term, that's where a lot of the research happens. And of course, we have a lot of, as you mentioned, research on people that have been to war and experienced, significant trauma in the face of crises. And yeah, it is important to discern between the two. Sometimes when I talk about trauma, we just use the term PTSD symptoms, because oftentimes someone doesn't have specifically exactly PTSD, but they're a trauma survivor and they're experiencing a lot of PTSD symptoms like hypervigilance to threat, difficulties with sleep, anxiety, etc. And so, yeah, that is a known risk factor for disordered eating. There's been a lot of work linking PTSD to eating disorders. And then, yeah, in the last few years, some of us have really posed the question, is the relationship between PTSD and eating disorders mediated by ultra-processed food addiction? And that's a question that we're, really trying to figure out.